I originally went to medical school at the University of Pennsylvania and then went down to Emory in Atlanta for my residency. And then actually I did 4 years in the US Air Force. So I went to Texas for 4 years and served there. I also had a tour in Afghanistan where I went and served the wounded soldiers over there. I was there for about 4 months treating patients there as an ENT, and then came back and actually moved here to join this practice about 2 years ago now. So it's been overall, have hit all parts of the country. I tend to focus most of my practice on the areas of sleep medicine as well as allergy. Those have kind of been the two areas that I've really focused my attention on. And they interact a lot in areas that you wouldn't really, or in ways that you really wouldn't think they would. So I typically try to help patients who have sleep apnea and are not able to tolerate their CPAP. So a lot of patients that I see have tried a CPAP and are failing or are having difficulty utilizing it, and I try to seek ways that they could potentially enable them to utilize it or to potentially do a surgery that might allow them to not need it at all. So I'll do different airway surgeries. I'll actually do different stimulators that can sometimes help them not to need a CPAP. And then allergy is another area, like I said, that is kind of interrelated, interestingly enough, because allergy involves obviously not only your allergic reaction to something, but often manifests itself in the airway, which is the main area for the ENT. So when allergists are dealing with nasal congestion, or your traditional allergists are dealing with nasal congestion, they don't really always have the ability to offer some of the other treatment options that as an ENT we do. So outside of offering allergy shots or allergy drops, which we do as well, and most traditional allergists do, as an ENT we're able to kind of take it to the next level and offer sometimes different procedural interventions or even surgical interventions that can really help people's breathing and help alleviate some of their allergic symptoms as well as treat their allergies overall. I think it's a really special experience from the very start. So you start out usually by having hopefully a nice phone interaction with our schedulers, but then from the moment you walk in the door, you're hopefully greeted by, really kind, caring front desk staff who their number one priority right now is, of course, your safety and keeping you distanced from other people and keeping you feeling safe and secure, but also, getting you processed through the system. And then we have our wonderful MAs who are our medical assistants and are pretty much right-hand people that help to kind of bring you into the clinic and get you oriented. And then you get to meet your physician, which is overall, I think, one of the best parts of our practice. The other physicians that I get to work with truly make it such a special experience. I think they're really one of the most outstanding groups of physicians I've ever had the opportunity to work with. So I think from the very start, it's a great interaction, and you kind of get that the whole way through. So a great surgeon comes down to pretty much knowing when not to operate. You can walk into anyone's door and they'll offer you a procedure that will fix, supposedly your problem, but it's not always necessarily the best thing or the right thing. You have to have someone who's willing to kind of give pause and step back, know what they can fix and know what they can't, and know when they should call for help and know when they can do something within their wheelhouse and do it really well. So knowing when to say yes and knowing when to sometimes say no to people surgically is, I think, the key to success, because it's a really personal thing to have someone do surgery on you. And you want someone that you feel really, really comfortable with and knows what they're really good at and also knows their limits. I think one of the most important things about this group is, like I said, the fact that these partners that I've been so lucky to join are really just some of the best physicians and most caring, comprehensive physicians I've ever met. I think the quality of care that you get with our group is really unparalleled. And you feel from the very start that these people not only care about your well-being, but want to make you better, and will do pretty much everything they can to help you find some solutions and give you some options. So I think you'll get that kind of personalized care here that oftentimes is hard to find elsewhere.